Here, Jenna uses the motions of flexion and extension, which involve the humerus, radius, and ulna bones, and a hinge joint. She hyperextends her knee at the hinge joint, which involves the patella, femur, and tibia. Abduction is performed as the ball and socket joint in the hip, which involves the coxal and femur, moves away from the body. Adduction is performed at the ball and socket joint in the hip, involving the coxal and femur as the leg moves closer to the midline. We are using the motion of pronation in the pivot joint, which involves the radius and ulna, to hold the ball. Circumduction is being performed at the ball and socket joint in the shoulder, which involves the scapula and humerus. We are using the slightly movable cervical vertebrae in our neck to rotate and watch the game. We are using the movement of dorsiflexion in the gliding joints in our carpals and metacarpals in order to stretch. We are inverting and everting at the gliding joints in our ankle, which involve the carpals and metacarpals. Lauren is elevating her leg at the ball and socket joints in her hip, which involve the coxal and femur. As Ryan gets subbed out, he uses the motion of depression as well as the ball and socket joints in the hip and the hinge joints in the knee with the coxal, femur, and patella in order to sit down. As Ryan attempts to pull Marcus back using the motion of protraction, he uses the ball and socket joints in his shoulder as well as the hinge joint in the elbow alongside the femur, radius, ulna, and scapula.